Parasram. Let us now hear from the Minister of Health, the Honorable Terence Dial Singh, who will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to you.
Good morning.
Good morning to my colleague, Minister Paula Gopi-Skoon, Minister of Trade and Industry, and to the Chief Medical Officer, Dr. Roshan Parasram, and a very good morning to ladies and gentlemen of the media and all citizens of Trinidad and Tobago, wherever you are this good Monday morning. My report this morning is a report with a difference. Every stage of the government's and countries' reaction or response or preparations for COVID, every stage could be considered critical, whether it's the provision of the parallel healthcare system, treatment, testing, tracing. Every stage is absolutely critical. This morning, we enter another critical phase, a very critical phase. The difference with this phase is that it is not solely the government's responsibility. It is not solely the responsibility for testing. It is not solely the responsibility of our healthcare workers. This morning, I want to speak clearly to the responsibility now of 1.4 million people. The individual responsibility. How each person can now play their part. Some have been doing it from this morning for us to keep on flattening the curve, to keep our numbers low, to make sure that we don't add to the 8 persons who have died or the 116 cases that we have as positive. This morning, I am speaking directly to Mr. and Mrs. Trinidadian, Mr. and Mrs. Tobagonian. And if I could ask for the graphic to be put up, and hopefully it will stay up for the length of the next couple of minutes as I talk to the country as to what we now expect. What role can you play? And I'm hoping that the graphic could come up so we could talk through the role of each person as we adapt and adopt the new normal. What are we asking each person to do from today? Very simple. Wear a mask when you go out in public. Wear a mask. I did a rough drive-through to Southern Main Road, Cureb this morning, the Cureb Junction and the Sanwa taxi stand. And I was pleased to see again the doubles person on Cureb wearing masks, encouraging people to do social distances, but still selling some people without masks. You see this little mask can save a life. The next thing, keep your distance. I saw it with the doubles person in Cureb. And I want to congratulate them. I saw it with the pie man on Cureb Junction. He not only had on a mask, he had on a visor because he felt he needed to protect himself. And I'll give you what that pie man in Cureb said to me this morning. He said, Minister, don't open up too soon. He said, Minister, I am willing to take a financial bounce so we could save lives. And I'm asking people to heed the warnings of this very intelligent pie man on Cureb Junction with whom I spoke this morning. Third point, stay home if you are ill. This is a time for employers, supervisors, bosses to really speak and have a close communication with your employees that if you are ill, to stay home. That can help save lives. This is where Mr. and Mrs. Trinidadian and Mr. and Mrs. Tobagonian can help. This is your contribution. Wash your hands. You would have seen Dr. Michelle Trotman on Saturday. Your hands are what transfers the virus from a hard surface to your nose, to your mouth. So wash your hands. Use an alcohol-based sanitizer. Cough into the crook of your elbow so you don't spread the droplets. Avoid touching your face. This is even some advice I have some trouble with. but avoid touching your face. That is how you introduce the virus into your mouth and into your nose. And clean and sanitize all surfaces, tabletops, door handles, cell phones. Don't share cell phones. You know, we have this habit, somebody call and you pass your phone on to somebody else. That is how the virus will move from one person to another. So all hard surfaces, don't do that. And that is how we adapt to the virus and adopt measures for the new normal. This is the new normal. And this is where Mr. and Mrs. Trinidadian, Mr. and Mrs. Tobagonian, your role now. This is your contribution. And your contribution doesn't cost you money. This simple mask can be made at home. You know, don't wait for the government to give you a mask. Don't wait for field to give you a mask. You could take an old t-shirt, a bandana, which we all have at home, and this is now a life-saving tool. This simple piece of fabric is a life-saving tool. Look at it that way, right? So when you go out into public, wear a mask. So ladies and gentlemen, my COVID update to you this morning, as we adapt to the virus, that we adapt and adopt. We adapt into the virus, and we are now adopting public health measures to stop the spread of the virus as we open up the economy more and more, as more people come out, more people work, more people interact. We must adopt the measures that will help us get through this, and this is what the new normal means. So Minister Cox, that's my very simple message this morning, and I thank you for the opportunity.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Good morning, Honorable Ministers, members of the viewing and listening public. My status update for the 18th of the 5th, 2020 is as follows. The number of samples submitted to the Caribbean Public Health Agency as well as the University of the West Indies site for testing, 2,682. Number of repeated tests, 412. Number of unique patients tests completed, 2,270. Number of positive tests stand at 116. Number of deaths due to COVID in Trinidad and Tobago, 8. Number of patients that remain in hospital stands at 1 in the Cora facility. 107 persons thus far have been discharged. In our state quarantine facilities, we have a total of 61 persons. There are 24 healthcare workers at the Napa institution. In the Tacarigua facility, we have 21 persons, and at Cascadia, there are 16 persons housed. Minister Cox, that's my clinical update for this morning.
Thank you very much, Dr. Parasram. Minister of Trade and Industry, the Honorable Paula Gopi-Schoon, will speak on the importance of the risk-based approach to the phased reopening of Trinidad and Tobago's economy to protect human capital.
Thank you very much, Minister of Communications. And of course, good morning also to my colleague, the Minister of Health. Good morning to Dr. Parasram, and good morning to all the viewing and listening audiences. And today I'm privileged to speak a bit from the business perspective as to where we are with this virus. I bring you back to Saturday, 9th of May, 2020, when the Honourable Prime Minister announced a phased reopening of the Trinidad and Tobago economy. And phase 1 included food and restaurant establishments engaging in curbside and pick-up and take-out and deliveries and so on, and some aspects of manufacturing, including cement and tobacco and DRI and so on. On Saturday, 16th of May, and you will recall that he said then, on Saturday the 9th, that he would allow for an earlier reopening depending on the state of play with regard to the virus and the progress that we were making. So that on the 16th of May, further adjustments were made, wherein in phase 2, all manufacturing, all construction activities, as well as auto repairs and tire shops, laundry and dry cleaning services, those were accelerated, as the Prime Minister had said, from May 26th to 21st of May 2020. I want to bring you back a little bit before that. We all must remember that several sectors of the economy were never closed. In fact, in our country, there was no state of emergency, there was no complete lockdown or so. So that supermarkets and parlors and food marts remained opened. Pharmacies, agro shops, agricultural activities, hardware and electrical stores, financial institutions, oil and gas operations, electricity, water and sanitation, and essential manufacturing remained open as well. We never closed our borders so that there were goods entering our country and leaving our country. The ports were operational. And therefore, by May 21st, workers in several other sectors will now be back into employment. But of course, subject to the individual commercial decision by firms, some will stay and work from home, some will be actually at the workplace, some will have staggered hours. But what I'm trying to say is that economic activity will be ramped up even more. So that what we will expect by then is that we would have had all of the manufacturing sector out, all of the construction and mining sector out, all of agriculture, all of the financial institutions and insurance, all of the petroleum, petrochemical industries, etc., gas industries and so on. Those will be out. But some of the retail, retail sector, retail wholesale distribution, we still have some of that to come in the other phases. And of course, your public services are deemed to be entirely operational. I want to say with COVID-19, the pandemic, and even before that, government's health response has been very proactive in the sense that the containment framework would have been laid with all of the measures, and I need not go into those. But what I must say, and I have said it before, reiterate, that Trinidad and Tobago is now in a very good place where economic activity is being responsibly reintroduced, and this has been based on the advice of our public health officials. It has been based on health science, public health science. The main challenge now is getting all types of businesses back on track in the shortest possible period, but without eroding the gains made in maintaining the public health environment over the last 2 months. And people talk about ensuring lives, and we must move on to livelihoods, but one does not exist without the other, because you can't have livelihood without lives. The business ecosystem depends on lives, customers to come into your organization, and customers, a healthy workforce as well. So you have to have lives in order to have livelihoods. And that's the sense of it. So that whilst the measures adopted by the government have been extremely successful in neutralizing the immediate threat posed by COVID-19, and of course we've been recognized for that, the fact is, it hasn't, and business people need to understand this, it has not eliminated the underlying dangers of the virus and the inherent continuing threat to human lives and to our safety. So that it is important that we continue, and the Ministry of Health continues, the risk-based approach to the phased reopening of the Trinidad and Tobago economy, especially as we note the resurgence of the virus in several countries of the world. Naturally, this approach must involve the strict observance of the guidelines for the reopening of businesses, facilities and institutions, but this has been issued by the Ministry of Health. I think it was on the 15th of May. But businesses also have the responsibility to put in place their individual protocols, which I know which have been seen and approved by the Ministry of Health. I spoke about the resurgence of the virus and the comeback that it's had in China and Singapore, Japan and Germany and so on. And even this morning, Minister of Health, I was looking at the situation in Brazil.
Correct.
And in Brazil, I mean, you had 485 deaths over the last 24 hours and so on. So that there are countries that have shown they've put in place, they've done the phasing in, but it has not served them well. So business people, we ought to be careful. Going forward, I want to say that we recognize the significant challenges that are being experienced by firms of all sizes, and of course there's a need to bring the economy back into its normal state. But again, it has to be acknowledged that bringing persons back into full employment, we have to be careful about. Yes, it will relieve their hardships, but we have to exercise the care that is necessary. We remain particularly concerned about the impact of COVID on the MSMEs, given their important contribution to the economy. And based on the information by CSO, there are approximately 16,547 MSMEs employing over 90,000 persons in Trinidad and Tobago. But again, I remind you that many of these MSCs are back into employment. And I say so because I looked at the CSO's figures and I looked at the sectors that have been open, and so that there are a number of them back into mining and quarrying, to manufacturing, to construction, to financial and insurance activities. Again, there have been some introduced into the hotel retail sector, but there are some of those that are still to come. You're talking about the furniture stores, the bookstores, and so on, the ICT stores, motor vehicle sales, and so there's some to come. But a considerable amount of SMEs are already back in business, and persons engaged in employment in those particular sectors and subsectors. At this stage, I just want to say again that from the Ministry of Trade standpoint, that we've had a very collaborative approach with the private sector throughout the last 2 months. And there's an interministerial committee that the Prime Minister had established. I co-chaired along with my colleagues, Minister of Works and Transport, also Minister of Agriculture, Lands and Fisheries. And again, we have also engaged, the Prime Minister has already put in place to the Roadmap to Recovery Committee, which is a full engagement of businesses and professionals and so on, right across the country and across all sectors and so on. I want to say that we've been in direct collaboration with the TTMA, the Trinidad and Tobago Manufacturers Association, the Trinidad and Tobago Chamber of Commerce, the AmCham, the Greater San Fernando Area Chamber of Commerce, all of the Confederation of Chambers. Only last week, Friday, I would have met with all 12 members of the Confederation of Chambers virtually. I try to meet with them very often because of the concerns of the MSMEs. But again, our discussions have, I think we're making good progress, and our discussions have always been about public health. Of course, food security, as you know, I've been involved in that from the onset. But of course, it has been about business sustainability and job security. So we will continue at the Ministry of Trade and Industry with the collaboration with the private sector to ensure that we preserve the country's economic stability and business continuity. But despite the challenges of the COVID-19, but we play it the safe way. We remain alert, and we remain at the advice of the Ministry of Health and the public officials, the public sector officials. Thank you, Minister.
Thank you very much, Minister. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. 91.9.
Hello, good morning to the panel. Good morning, ministers.
Good morning, sir.
Good morning.
Vern Extavo, 91.9 FM. Hi. Minister Dial Singh,
yes,
on my afternoon drive program on 91, we've started to do a community outreach situation where we ask for persons to tell us of the issues and areas where they want to help. And one that stood out in particular last week was one from your constituency. And the constituents themselves is saying that they feel like you may be a little bit overwhelmed with the COVID situation, and they haven't been able to get some assistance because they've been going to the office to get some guidance on rent assistance and different things. And they may feel a little bit, for want of a better word, neglected in terms of that. I just wanted to get your feedback on that position. Sure. and feedback on MPs being available at this time and their role. Sure. And the second question is, we have not, I would think, not heard enough from the Ministry of Education. The last release I have from them was the 3rd of May. I want to know what advice you would have given to the Minister of Education in terms of SEA and getting schools back up and running, because a lot of speculation that in September we will restart the school year, or it will be a lot of terms cramped into one. I don't know if you could give any insight on that. That would be helpful. Thanks. Good morning.
So on the issue of the MPs' offices, MPs work through their staff. I could tell you in my office on Saturday, we gave out over 200 sets of relief in terms of food. Through my office, we have given out over 1,000 care packages to constituents since this started. We have given out 500 food cards. On the issue of rent, I personally visited in Mount Dore about a week and a half ago people who were having difficulty accessing the rental grant. It had nothing to do with my office. It had to do with the requirements in the Ministry of Social Development's office at Arangwes Plaza. I immediately called Minister Camille Robinson Regis to address that issue. So my office is functioning. Both myself and my staff are out every single day assisting people. So I give you the assurance that my particular office is up and running every single day. There was an issue with rent, and as I said, I addressed it with the Minister of Social Development to have a chat with the Arangwes office. So that's that. On the issue of SEA, we will advise the Ministry of Education on anything to do with education, but I can't speak to that in a comprehensive manner right now. That is for the Minister of Education to speak to. And I want to thank you for the excellent work you are doing on your program. Keep it up.
I just want to add that the Minister of Education will be here soon. Express.
Good morning, everyone, ministers.
Good morning.
Good morning.
Good morning.
Kim Bodram from the Express. Two questions, maybe Minister Dayal Singh and maybe the CMO, and I'm going to try to be as specific as I can. So the first question would be, Minister Dayal Singh, with regard to the borders being porous, and I know this is something that maybe the National Security Minister might have addressed, but there's still a concern as to whether or not Venezuelan nationals are coming in illegally in fair numbers, you know, anywhere along the border, and that if it is that we may have flattened the curve, then this is a continuing risk of importation. So is that really still an issue? Is it being addressed? Also, and again, to try to be specific, we are opening back up. We understand the protocol, physical distancing, wear your masks, wash your hands. And I've seen a lot of doctors raising this issue, and you did mention testing this morning, that everything can't depend on government testing, etc. But when it comes to asymptomatic carriers, is it that we have an idea really that we could feel safe going back out, that some 80%, I think it can go up to, of carriers can be asymptomatic, and how certain are we as to the status of the virus, that it may not even be present anymore in this country? And is it that we're just going to wait now and see if there's an influx of infections, possibly from these asymptomatic people? And we do understand that a lot of people have not been turning up for testing, and that really limits you know, your ability to get a handle on the situation. I hope I've been specific enough.
Sure.
Because people want to go back out and they want to know, is this basically guinea pig week? Is it that we're going to wait and see how many people get infected, or do we really have a specific idea of where we stand?
Okay, so on your two questions, the issue of porous borders, I would suggest that you raise that with the relevant minister, who is Minister Stuart Young, Minister of National Security. I wouldn't attempt to answer that question, but just to say, Cabinet, I took a note to Cabinet of June of 2019, in which that note spoke to the provision of primary health and emergency health services for all non-nationals, inclusive of vaccinations and testing, and I revisited that note last week, and the note says other infectious diseases. So as far as the health response is concerned, there's cabinet approval, which I spoke to at one of the Prime Minister's press conferences maybe about a month ago, that anybody in Trinidad and Tobago can have full access to emergency and primary healthcare services, which at that time didn't specifically say COVID, because in June of 2019, nobody knew of COVID, but the note did say other infectious diseases. So that takes care of the health response. Your other question, I think the Chief Medical Officer is the best person to answer that part about asymptomatic carriers.
Dr. Parasram?
So I think we took the decisions that we took in terms of advising the Prime Minister and other ministers regarding the epidemiological progress of this disease based on what we were seeing, based on testing, based on the number of cases of acute viral illness that was coming into our facilities, based on the number of deaths that we were seeing. So there's a number of factors that we take into consideration. We haven't seen any evidence of a large scale, in Trinidad at least. When you deal with asymptomatic carriers, you're talking about international statistics. It is a brand new virus, and the data is coming forward as to what level of asymptomatic carriers you're getting. A lot of the data is based on serological testing, which is antibody testing, saying that there's an antibody present 10 to 15 days post-infection, because the PCR results in an asymptomatic person is generally negative, which we have seen in Trinidad as well. If you have asymptomatic carriers, there would be, for instance, if there's one person in a household that is asymptomatic, carrying the disease, chances are that their primary contacts, which is their household members, one of the other persons will present with illness. And as our numbers continue to be very low, even in people coming in to seek attention and seek testing, the expected outcome is really basically that the level of transmission in the country as a whole, whether it be asymptomatic, mildly symptomatic, is extremely low. Just to go back to the fact that we had our last 116 case 23 days ago now, there has been no presentation of severe cases, mild cases, anything of the sort that we have picked up a positive case since there. That is going very close to now 2 incubation periods in length. So I think we are comfortable, and we would not have made the recommendations to the other ministers if we were not comfortable that the level of transmission in the country was significantly low to allow for an increased mobility of people. It would have been putting us all at risk. So there's no, I mean, that comment related to guinea pigs. We make our recommendations based on what we see before us epidemiologically. We will not put the population at risk in any form or fashion. If we thought there was a risk of transmission, we would not have recommended that we do the phase opening at this time. Minister Cox?
Let me just come in here. I think that comment about guinea pig week, I think it's unfortunate. It gives the impression that we don't care about the population. That is simply not true. And I urge us all to be, really cognizant of how we communicate to the public. And that's why I started off talking about the public health measures. If we lose sight of the 6 measures I spent 5 minutes on, hand washing, wearing masks, it is these simple, inexpensive measures that will allow us to open up more and more sectors of the economy. So I really urge us all, myself included, to adopt these simple public health measures, to adopt the new normal as we adapt to the virus. Thank you very much.
Thank you. 98.1.
And a very good Monday morning to the head table. Stephen Cummings from 98.1 FM.
Morning.
Good morning.
2 questions, one for Minister Gopi Skoon, and the other, Dr. Parasram or Minister Dayal Singh can take that one. Minister Gopi Skoon, the virus has had a devastating impact on our local economy with serious negative implications on even our levels of competitiveness and ease of doing business. We are forced into a new way of doing business. Just where and how do you see us as a country coming out of this post-COVID-19? And what are some of the key productive sectors you see can give us that immediate jumpstart for economic revitalization? And Dr. Parasram or Minister Dayal Singh, as we continue to build capacity and in the interest of quality assurance testing in the private sector, does the ministry have a full list of private testing labs to those which have agreed to be subject to what we call the PT panel system? We talk about a grading system, basically. Earlier, we heard that there were 5 such labs which expressed an interest, and later there were 3 which expressed an interest in continuing the process.
Mr. Cummings?
Yeah.
All right.
So
Okay.
I will go first with the labs and then Minister Paula Gopi-Schoon. So both myself and the CMO will answer the question on private labs. The CMO on Saturday and before would have put out the process by which private labs can be quality assured. And let me just say, the lab that we did at UWI, the virology lab, had to go through the same hoops, jump through the same hoops that we are asking any private lab to go through. As the Minister of Health, I'm speaking here as a policy maker now. We have in the regulations, very simple. We are just asking all private labs, once you are certified, to report your results to the Chief Medical Officer. That's all we are asking to do. We are simply asking, and the Chief Medical Officer I will urge to come in here again. As this morning, I am not aware that any private lab has gone through the full QA process, and that is all we're asking. And as minister, I subjected the virology lab at Eric Williams to the same process that we are asking every private lab to go through, because this has to be reported to the WHO. The same process the virology lab in the UV had to go through with CARF and PAHO is the same process that the Gene Expert machine in Tobago will have to go through. It's the same process that the PCR machine in San Fernando will have to go through. This is a national effort, public, private. We are urging all private labs who are interested in offering COVID testing to comply with the national effort. And I will now ask the CMO to come in now on the technical details, as I have dealt with the policy position.
So I think your specific question was, do we have a full list? So we have the list that has been submitted doing COVID testing. There are, of course, labs in Trinidad that do other types of testing. Caribbean Med Lab Limited and other agencies have been compiling that in looking at a possible accreditation system for labs in general. So as you said, we have gotten 5 persons thus far. Where we have reached in the process, the PT panels would have gone out. One of them, I think, on Friday last week. We hope to send out the other 2 early this week, between today and tomorrow. And then, of course, the assessment will be done by Friday. So in terms of the process, as Minister has said, the same process was borne out at the labs, our lab in North Central, and we were successful in completing the PT panels and got a good result, and thereafter we started. And even after starting, I just want to add that we put it, even to be a little more rigorous, training wheels onto the lab, in the sense that 10% of the samples that we do there, we still send back to Caribbean Public Health Agency for a verification process to ensure that all the tests that are coming back are actually true negatives and true positives. In terms of the community testing I omitted earlier, we had done 955 community tests thus far, and all of them remain negative.
Before we go to Minister Gopi-Schoon, I need to emphasize the point that the CMO just made. We are subjecting, because we discussed that this morning before coming to this press conference, 10% of our negatives that we get from UWI to CARFA for validation. That is how seriously, Mr. Cummins, we are taking quality assurance. So the same quality assurance that we are subjecting our own lab to is the same quality assurance we want all labs, private sector, public sector, from a policy perspective, so we can trust the results. We must have trust and faith in the results. Thank you very much.
Minister Gopi-Schoon.
Thank you, Mr. Cummings, for those 2 very important questions. I think your slants were on ease of doing business, and the second on the impact of COVID on the economy and where do we go from here, which are the important sectors going forward. So let me just take the ease of doing business. We are not in a good place, and we've said that before. I've come to the population and said 105 out of 190 is not good enough. But through the single electronic window, we have been focusing on e-business, to call it that, and dealing with the indicators, the 10 indicators under the doing business report, which we are measured by, and we are going to be measured pretty soon. I'm pleased to say that we have made some progress, and the progress would have been in terms of Develop TT, which is the platform for getting a construction permit in a much, and we're pleased about the gains we've made there. We've moved from getting one in 270 days to getting one in, by example, an uncomplicated request in 38 days, which is a great standard and within world standard. But we have to move further than that. So yes, we have to move from e-business to e-government. That's what the population wants. But even within business, we are looking at several reforms, and across we are looking at, for instance, reforms for e-payments for business, but across government as well. We are also looking to having a connectivity between, let's say, all of the ports, the single electronic window, and the customs, so that we have that interoperability among all the connected agencies. But where we have to go, as I said, it is, and the Prime Minister has spoken about this, is creating a digital economy. That's what the population wants, so that there's this e-identity. The Prime Minister spoke about it in his discussions with the President of Estonia. He spoke about the agreement which we are going to sign pretty soon. I know that the Ministry of Public Administration is working on that. So you can hear further discussions coming forward. And especially through the recovery team as well. There's definite focus on the doing business, the overall e-payments and the full gamut of e-services, but also on the creation of this digital economy. And yes, COVID would have had a deleterious effect on our economy. And even before that, we have been talking about diversification. Let us realize that Trinidad and Tobago is an energy province, and we will remain an energy province. We are blessed with hydrocarbons, and the energy sector will always remain important. The manufacturing sector has been a significant sector, and they have contributed significantly. That's including food and petrochemicals and so on to the economy. They hired 52,000 persons. But going forward, there's every evidence, and given the volatility on the energy side of things, and given our connection to the world market, can't lose sight of that. It means that we have to pluck at which are the better sectors for expanding the economy and for transforming the economy. The manufacturing sector works well, and therefore that's the place to go. There are systems in place. There's the understanding of business operations. There are employees who are engaged and well trained, and so on. So obviously, the expansion of the manufacturing sector is one we are looking at. We have significant markets in the region. We have been looking extra regionally as well. The agriculture sector is definitely an area of focus. Whilst we may not have, in terms of agriculture, we may not have been contributing considerably to the economy. It's a sector which we have been working on. The Ministry of Agriculture, Lands and Fisheries has been focusing on the sector. They've played a key role in terms of the COVID response in bringing agricultural product to the population. We've done very well in the terms of the poultry industry. There have been a number of private sector interventions into agriculture as well. It's the way that we are going, and therefore that's going to be key as well. So I want to say, if I had to focus on any industries at all, yes, the relevance of the energy industry, yes, the expansion of manufacturing, and certainly to a greater focus on expansion in agriculture lands and agriculture and fisheries.
Thank you, Minister. While you're at it, there's a question here from online.
Sure.
It's to the Minister of Trade. It concerns the Employers Consultative Association. The person wants to know if they are one of the stakeholder groups being engaged.
Certainly, the Employers Consultative Association is a valued entity that has been in existence for a long time. Normally, I would admit that the Ministry of Trade and Industry does not have a direct engagement with them, because we engage with business employers through the chambers and also directly. We are largely a facilitation ministry, and therefore we engage directly with the entities and of course through all of the chambers as well. But let me also say that I know that the Ministry of Labour has a direct connection with the ECA, and I know that there is the involvement of those two entities, and I want to say without a doubt that I am also pretty sure that the Employers Consultative Association would be a valued institution going forward. I'm sure their views will be taken on board at the level of the Recovery Committee, so that they are going to be a formidable part of this roadmap for Trinidad and Tobago.
Okay, Minister of Health or CMO might be able to answer this. Employees in offices with many persons are not wearing masks as they feel public means outside on the street. Should they wear masks in the office among workers?
Yeah, so on Friday, and the CMO will go into details, on Friday, I would have signed off on an overall workplace policy that deals with all types of workplaces, whether you are factories, food service, offices. You would have had Dr. Said Rahman here twice speaking about the adoption of workplace practices. And yes, it is advisable that in workplaces we adopt some of these new measures, and I will now ask the CMO to speak about details as far as this goes.
Right. So in terms of the question, not wearing masks inside your office spaces, it really depends on, we have to use a common sense approach. It depends on your potential risk and your ability to maintain social distance. So if you're in a space that is extremely cramped, you're not able to get the 6 feet apart, there are no cubicles where there's some sort of partitioning in between, I would advise that you use that your risk would be higher and that you can wear masks as you see fit. Once you can maintain the social distance and there's adequate partitioning, then maybe not so much. If you're going into a meeting, for instance, and the meeting is in a smaller room and you cannot maintain social distance, of course you should wear a mask in that setting as well. So there must be a common sense approach, and not an either or, but in terms of indoor wearing of masks, you're looking at being able to maintain social distance adequately as your yardstick, for want of a better term, for if and when you should wear a mask in an indoor setting. Of course, the guidelines will go into depth, and I think it's important, and as we continue monitoring the implementation of these guidelines in workplaces, the county medical officers of health are the ones that are charged with the monitoring function. So if there's a workplace, for instance, that is not complying with the guidelines, a message can be sent to the county medical officer of health. Through the public health inspectorate, we can go in and advise as the best way to place cubicles, best way to have your lunch spaces, alternating of spaces. So there's a monitoring function that the ministry is doing now, and we can advise workplaces as to how to comply.
The lesson to be learned here, ladies and gentlemen, and I think we have said this several times before, it is difficult to be overly prescriptive for each floor type of building. As the CMO says, a lot of this boils down to risk evaluation by the particular company, by the particular supervisor, and just adopt a common sense approach. It is difficult to have in law and to prescribe for every single outcome. This is what the world is now grappling with. And we just have to use some common sense when it comes to these things, and I think the CMO just gave some excellent common sense advice. Thank you.
Thank you. 95.5.
Good morning, everyone. Whitfield Turner from I-95.5. Dr. Parashram, there's a situation I'm hoping you can bring some clarity to. In one of the pressers last week, Dr. Bernard would have said that she doesn't believe that there are any hidden cases in the community. And then on Saturday, Dr. Hines would have stated that going 21 days without a new positive case does not mean that the country is COVID-free. And there's apparently some contradiction in the minds of some with these two statements. I don't know if you can clarify that for me. And Minister Dayal Singh The slide you had up earlier with respect to cough etiquette, there is some concern where that is concerned in the communities of the elderly and disabled. Persons in those groups who need assistance from another individual to move around. When they are moving around, the most likely place that they would adhere to, the most likely body part they would adhere to, is the very place that we are being asked to cough and sneeze into. So I don't know if there is anything that you can say to allay the concerns in that regard.
Okay, so I know. This thing is going to throw up a lot of permutations and combinations. What I could tell you as far as the homes are concerned from a policy perspective, and then the CMO will talk about details. You would have heard me say at the Prime Minister's press conference that we are going to be engaging some more boots on the ground, people on the ground, to assist the county medical officers of health. So before coming to the press conference this morning, I met with the CMO and the PS, and we have taken the following decision. One, we will be engaging 50 persons to assist with the county medical officers of health. And in doing up the job description to engage them, I took that decision this morning, that they will be, as part of their job description, to actually assist the county medical officers of health with these long stay homes. What we are doing now, and the CMO could confirm, is doing up the job description, and in the first instance, on a policy level, I have indicated to them that we engage the third-year medical students at St. Augustine to assist the county medical officers of health. This will do several things. One, it gives us more boots on the ground, more critical eyes, because a third-year medical student will have some training. And three, it gives those medical students an insight into public health from the ground up, not just a theoretical basis. So we have taken that decision to go to the third-year medical students to take on 50, have them trained in a short space of time. It is basic training to work alongside the county medical officers of health. That's the policy position we took, and now the CMO could talk about the details of the issue that you have raised. CMO?
Yes. So in terms of the monitoring, so they will be performing a monitoring and evaluation function. Minister would have spoken about the guidelines that was disseminated on Friday last week. With any document and any guideline that is produced, there must be some monitoring and evaluation function, and I think that's where these students will play a critical role. For instance, when you got the question about the mask, you would have seen that someone noticed in your workplace that they weren't abiding to certain guidelines, or there weren't protocols in the workplace that spoke to social distancing, and therefore they were at risk and they needed to wear their mask. So the monitoring and evaluation function will tell us basically at the workplaces what is happening, whether the guidelines are being adhered to, whether there are protocols being put in place out of the guidelines. So that is the function of that cohort. With regards to your hidden case question, I know there was divergent views to some extent, I would say, from what Dr. St. Bernard and Dr. Hines said. Dr. Hines was being a little more conservative of the two, I think, when he said there may be hidden cases still. And I think we always have to take a pessimistic view when we look at it, that there may be some hidden cases that we have not found, whether it be asymptomatic carriers. But either way, I think the levels are low in the population, low enough to allow us to take the decisions to reopen. Dr. St. Bernard was being a little more optimistic, if you want to put it that way, and she said she doesn't think that there's any cases at all. I mean, and there have been divergent views amongst other CMOHs saying that they can't find any cases. Up to Saturday and Sunday, I would have been in communication with the CMOHs. Some of them are getting no cases at all walking into the entire county of viral illness, which is a good sign from a control perspective, because it obviously means the numbers of viral illness and diseases are very, very low in the country, the number of severe cases coming to the hospital. So I maintain that the numbers are very low. I mean, there are divergent views for public health practitioners across the world. So I think it's no different in Trinidad. It will have the description of the divergent views being slightly different, but on both counts, It recommends moving forward and recommends as well that the levels are extremely low in the country.
Let me just come in here again. You ask about long stay homes and people coughing into the crook of their hands, and this goes back to the point. If you are ill, you are not supposed to be working. So any owner operator of a long stay home should not allow any employee in any long stay home who is coughing, who has a fever, to go in to the facility. This is where, if you put back up that slide this morning, that slide is so important.
It is.
That slide will save lives because the question you ask, it's there. I spoke about it this morning. If you are ill, which one is it? If you are ill, it's supposed to be there, but we always tell people, yes, look at here, bullet point number 3, stay home if you are ill. So any owner, leave that slide up, any owner operator of a long stay home, if you have an attendant who is ill, that person should not be near your premises. And that is how you answer those types of questions. Common sense. It is basic common sense and adhering to some simple public health measures. So my friend, I hope that answers your question. Thank you very much for raising it.
Thank you very much. We have some limited time, so we will try to get as much of your questions in as possible. Newsday.
Yes, good morning. Good news from Newsday. Good morning to the panel.
Morning.
Morning.
Yes, good morning, Minister. My first question, you mentioned at a previous press conference with the Attorney General about possible legislation to make mask wearing mandatory. Any feedback from the AG? That's my first question. And my second question, the issue of the socially displaced previously came up. I know we have done work on providing facilities for them and so forth. And I know the Port of Spain mayor is supposed to have launched a Move Along campaign. But working physically in Port of Spain, we still see a number of them. So I know my colleague talked about possible Venezuelans coming in on that threat. But how are we doing on that issue of we having socially displaced persons? I mean, they're not wearing masks. They're practicing the opposite of physical. What is being done about that? Those are my two questions.
Okay, so I'll attempt to answer them. The Attorney General is looking at it. He hasn't come back with a position. However, what I will say is that all business owners, whether you own the premise or rent the premise, legally you have the right, just as you see people saying no slippers, you can't go into movie town with slippers and sleeveless. It's the same principle that owners, operators of businesses can deny service to people wearing masks, and we urge them, no roti, no mask, no doubles, no mask, no gyros, no mask, no chicken and chips, no mask, no pizza. We are asking owners now to take on some civil responsibility. Help the government. This is what this is your contribution now to get people to wear masks. So it is not law as yet. On the issue of the homeless, you would have heard Minister Camille Robertson-Regis say on this very platform, because of a judgment, you cannot force someone to go into a shelter. And the last time she would have given figures, I don't want to quote the figures, but Minister Robertson-Regis addressed the issue of the homeless being given the option to come into shelters. But she can speak to that in much more detail.
Is there a question for Dr. Parasram, or you answered both?
Unless Dr. Parasram wants to add anything.
Anything to add, Dr. Parasram?
No, I think we're okay. Minister Cox.
Okay, thank you. Tobago Channel 5.
Hi, good morning. Candice Jackson from Tobago Channel 5.
Morning.
My question is to Minister Gopi Schoon. What have you noticed about the levels of import and export over this past 3 months while we've been going through this pandemic? Has it been lower? Are things coming in just as quickly as before or not? What has been like?
Well, let me say thank you for the question, but I'll tell you, the Ministry and the Minister of Works and Transport have been hard at work with COVID. The Minister got on and made sure that that particular weekend that the port was functioning and functioning efficiently, it did, so that all goods were being cleared at the Port of Port-of-Spain and the Port of Point Lisas were being cleared efficiently, and whether they were essential goods or non-essential goods. But as to the monitoring of what's coming in, so the things have been coming in, but we too have been keeping a close eye on the food and the essentials, the food, the cleaning products, the medication and that kind of thing, whether they've been coming in. And yes, and this is why we feel so comfortable that there is food security in this country, and this is apart from the security that we have via our agricultural products and so on. But we have been monitoring, and we are having the inflows. There are some challenges externally in some countries, and you may have read these. I mean, with the Smithfield farm, this is a meat sorry, not a farm. It's a factory being closed in the U.S. and we get a considerable amount of our food from the United States. But that factory closed. There were concerns as to whether or not we would have a supply of pork and so on. And you saw pigs being slaughtered in the U.S. as well, if you were paying close attention. But we are not directly affected. I think our businesses have had their eyes and hands on things. We've been having a good flow. Our Minister of Finance gave a commitment that we would have the necessary foreign exchange to ensure that our basic food supplies do come in as usual, and they have been coming in, and we thank him for that intervention. And so pretty much with regard to food security and with regard to the other items, we've been having a good flow.
Thank you. TV6.
Good morning, everyone. Urvashi from TV6.
Good morning.
Minister Gopis-Spoon, on that same vein, we see that the World Food Programme has cautioned against a global food crisis, an impending global food crisis. We see the price of staples, rice, wheat, potato, chickpeas have been driven up internationally, grocery items as well. Given that on March 23rd, you would have said that our country had a 2 to 3 month supply of food. Can you give us an update on we're 2 months down the line? Could you give us an update on our current food stock? And of course, can you guarantee any type of food stability? My second question goes to the CMO. Dr. Parasram, we're seeing some countries, Antigua and Jamaica, announcing their opening very soon on July 4th. That's to regional and possibly international travel. We're also seeing internationally sports coming back up. We're seeing that TNT has world-class facilities, of course. Sport is being resumed, and a lot of money is being paid to host these events. Given Trinidad and Tobago's current standing with the coronavirus, what would it take from a medical perspective for us to implement something like this? Thank you.
CMO?
Okay. So, for Urvashi, in terms of clarification of your question, you basically want to know, in terms of our borders opening up, in terms of sporting activities being allowed to progress? That's the question you're asking? Just clarifying your question.
So, I think it's sporting events in particular, because whereas some countries' borders are closed, they are allowing sporting events, they're letting the teams come in, quarantine for a certain period at a facility, and have the matches conducted without spectators.
Right. So we are at the early stage in terms of opening. We want to take a phase-based approach. As you have seen, we have gone through phase 1 fairly successfully, and we are starting phase 2 on Thursday. So our phases, as we progress from phase 1 through 6, 6 and beyond is we're looking at border opening, and there's no time frame for that. But we are talking about phases 4 and 5, later phases where we're looking at sporting activities and the like. So let us take it one phase at a time. I don't want to jump the gun and say what will happen. Of course, if we see an increase in number of cases, then we will have to hold the phases for a longer period of time. Hopefully, we will progress smoothly throughout all the phases, and we'll be able to get to the latter phases where sporting activities will be allowed to progress.
Thank you, Dr. Parasram. Minister Gopi School.
Thank you very much, Overshi. So you questioned food stability. Yes, I had indicated, and this is from the beginning of March, I had said that we had 2 to 3 months of supplies with another 2 months on the water and orders on hand. Again, we spoke about the foreign exchange assistance being given through the Exim Bank. So that again, let me say that the food imports, the basic needs imports have been pretty robust, so that things have been coming in. You raised the issue about external supplies. And let me say, yes, we are aware of the challenges in some countries of some basic supplies. But we have been, at the level of the ministry, doing our risk analysis by product, and so that we have been monitoring closely. What I can tell you is that some of the members of the private sector have had to look at alternative supply chains, so that we may not, and therein we would have had some minor price increases, some price increases, because for instance, there would have been a challenge with grains from a particular source. Many of the importers, with regard to dry peas and so on, they went to an alternative supplier, and they went to an agent instead of the original source of supply. And therefore that caused the price of some bean items to go up. And so that's the kind of challenges that we have had in terms of supply. But our importers, I mean, they really had their shoulders to the wheel, and where they have seen shortages, they have in fact, made other arrangements and gone to other sources of supply. We, as at the ministry, continue to day by day analyze, do the risk analysis by product when it comes to ensuring our food security. So we're working on it. I can say with all certainty that there is food stability in this country. And again, let me re-emphasize the work being done by the Ministry of Agriculture and our farmers. Our production level the production levels are up. I know that many of our consumers have begun their planting. I think everybody understands where barley grows now. You have to get into agriculture at all levels. I'm pleased with the Minister of Agriculture's seed distribution campaign. Please get on the program, everyone. Get involved. Grow something. Even if you're living in Woodbrook, get a little A-frame and start growing your things without having to go into the ground. You can do things on your porch. So food stability, yes, we have it, but you have a responsibility, the consumer, to ensure that you contribute to the country's food stability.
Guardian Media Limited.
Hey, good morning, everyone.
Morning.
Good morning.
Okay, so my question is either to the CMO or the Minister of Health, whichever one would like to answer. The first one that I have to ask is, has the file on private labs been handed over to the DPP as yet? And now, Minister Dialsingh, just now as well, you mentioned that it's a failure to report the results to the CMO, which is outlaid in the regulation. So what was it about the advertisement for drive-through testing that triggered the compilation of this report for the DPP? And my second question, Dr. Parasram, I can't remember if you mentioned it, but I just want to get a confirmation. Do we have any suspected cases at all in our hospitals or anything like that?
Okay, so let me take the first question. The legal department, as of Friday, is compiling the file. I will have no control over that process. That is an administrative process by a public servant. What we were concerned about was the advertisement of the offering of these services, for which the Ministry of Health is totally unaware. And the regulations specifically say that the results of any test should come to the Chief Medical Officer. The Chief Medical Officer could now tell you, once again, whether any lab has gone through the QA process and whether any lab has agreed to send results to him. So I hand you over to the Chief Medical Officer.
Right. So in terms of your question, I haven't received any test results from any private labs stating negative, positive, whatever. So therein lies the regulation. The regulation states that if you are doing COVID testing, you're supposed to report the results to the Office of the Chief Medical Officer. All we're asking for at this point is reporting. And it is critically important, even with negative patients, we need to know, once you take a swab from someone, there's an inherent risk that that person is a suspect case, and therefore we need to do the public health measures that follow. For instance, we need to quarantine the primary and secondary contacts, so we really need to know either negative or positive. We need to have an idea at the Ministry of Health what are the cases, so the county medical officers of health can get involved very early. Whether it turns out to be negative or positive, at least we are aware of it and we can take the necessary public health measures.
Richard, yeah? Let me just come in here from a policy perspective to tell you why this is so important. We would have said here that unless we have faith in the testing program at private labs, we are going to run the risk of having people receiving false negatives. From the day we got our first true positive via CARFA, and the CMO could bear me out here, he called me, this is over a month and a half ago. On that same day, he got results from a private lab in the East stating that there were 3 other positive patients. It turned out that those were false positives. We have since had, and the CMO can bear me out, false negatives. What is happening globally, and if you follow it, outside of PCR testing, every single rapid test done to date by any particular company, every single serological testing has thrown up ranges of false negatives from 15% to 50%. I don't know if that is being lost on Trinidad and Tobago, how unreliable tests outside of PCR are. And if you have labs doing these other rapid tests or non-PCR tests, you are going to have between 15 to 50% of those persons receiving a false negative test. What does that mean? They are under the impression, I have gone to this lab, I have paid $1,600, so they figure they're getting value for money. The tests tell me I am negative, and I go home, I am actually positive, because the false negative failure rate is between 15 to 48%, and I infect my whole family, I infect my whole community. That, Richard, is what we are trying to avoid, because PCR testing is the gold standard. You had Dr. Naresh Nandram here last week saying it is 99.96% accurate. It is because that we have stuck to protocols on testing and not given in to these fads that we are in the position we are in today. These are hard-won gains, and we don't want to lose these hard-won games by going on to the bandwagon for serological, I could never pronounce that word correct, S-E-R-O-L-O-G-I-C-A-L, the CMO can do it, serology, whatever it is, and rapid tests. Or I can have a good laugh at me this morning. There are some words that just give me trouble. And rapid tests, which have these high failure rates. We are trying to protect the country. And it is this protection so far that has now allowed us to advance phase 2 of the opening and merge it into phase 1. Let's not lose sight of all of that. It is because we are being careful and cautious, and as the CMO say, pessimistic. You prepare for the worst, but hope for the best, Richard, is what has us in this position now. So let's not lose that position, okay? Thank you very much.
Thank you very much, Minister. I just wish to apologize to some members of the media who didn't get the opportunity to pose questions to us, but we are out of time. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As you are aware, the Prime Minister recently lifted some more of the COVID-19 restrictions. Phase 2 of the reopening of the country, which was initially scheduled to begin on May the 24th, will now begin this Thursday. Phase 2 allows the entire manufacturing and construction sectors to return to work and will include the reopening of auto repair and parts shops, tire shops, as well as laundry and dry cleaning services. Our borders remain closed, except for the managed entry of persons, including students from the University of the West Indies from all campuses across the Caribbean. However, we are asking domestic workers, spas, hairdressers, barber shops, religious institutions, pubs, cinemas, and others to hold strain a little while longer because these sectors present a greater risk in the spread of COVID-19. Sometimes the right path is not the easiest one. Registered maxi-taxi and taxi operators will benefit from a one-time payment of a $2,000 fuel support grant, and the government asks that they continue operating at 50% passenger capacity. This grant will be coordinated by the Ministry of Finance and the Ministry of Works and Transport. More details will be provided in the coming days. I wish to remind you to wear a mask at all times. No mask, no service. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.
And let me just say one last